We normally outsource our health to the doctors or other care providers. My message is Own Your Body, a new book which I have just got released by Bloomsbury, which deals the story of 21 such people who told me how actual their problems are. The book relates to maybe each one of you. Millions would be in one kind of a prototype. The story of a young man who was drinking but did not know that he had inherited it from his father, or a young girl who had gallbladder stone, or someone who was using pills and antibiotics every day. All these stories would make you realize maybe you are one of them. I suggest read Own Your Body, take yourself to longevity, use the 50 life-saving steps in this, and of course the 10 commandments. Also you will ensure that the progeny, your children, are healthy and the grandchildren are healthier. Take it in your hands, make your engine, make your body stronger and lasting for longevity. So do you want to know whether you have fatty liver, and if so, how to fix it? Fatty liver, if your parents have diabetes, blood pressure, heart disease, cirrhosis, cancers, or snoring, or polycystic ovary, you have fatty liver. If your parents have given this to you, how do you fix it? If you already have diabetes, you have fatty liver. If you are having BMI above 30, 23, or you are overweight, you have fatty liver. If you have high cholesterol, triglyceride, or your waist is big, or you have a HbA1c above 6.5, you have fatty liver. So find out if you are in one of these categories and fix it. Remember, your weight should be height minus 100 if you have no family history or yourself. 170 minus 100, your weight is 70. But if you have inherited bad genes, 105, you should be 65 kg. And if you are female, just 60 kg. This is the first way. Remember your Dinacharya. So you have the time dependent or time restricted eating. You eat between 6 in the evening, after that no more food, or not before 8 in the morning, and you will have a healthy liver. So avoid fatty liver, fix it yourself, self-test and diagnose and treat. Fixing fatty liver by a doctor is not easy, because very few adhere to lifestyle modification or diet or exercise. So when a patient comes to you, besides telling this, you have to treat him. So the first choice of drugs can be Saroglitazar, which decreases the fat in the liver, and a small amount of hard fibrotic liver. The second choice could be metformin or drugs like GLP-1 agonists or SGLT2 inhibitors. Although the data is limited, the diabetes drugs can be used. Some amount of benefits can be with obeticholic acid. But today, I would say all of these are still in the trial phases, not for very large usages. I would strongly recommend that the lipid levels should be lower, the blood pressure should be maintained. Every fatty liver patient must have a cardiovascular assessment, because more people die of fatty liver due to heart problem or due to cancers. And ALT is a single marker. Keep the SGPT below 20 for women and below 30 for men, and the lipids, especially LDL, at a lower level by using appropriate drugs.